We have a pretty loose agenda today, but it will be recorded. Kyla, if you want to start the recording, if you're not able to stay for the whole meeting or you want to play it for others, there will be a recording. So thank you. So today we will have a couple people talking that are somewhat different than other meetings. We have someone from the EPA talking about a safer choice label, a label that has some properties that make it less damaging, I guess I'll say, less toxic. And we'll have them talk a little bit, and then they will come on our Wednesday office hours this week to go into further detail. So they're going to introduce it today and have further discussion on Wednesday. We have Penny from our immunization department at the health department talking about vaccines. We've had a few questions about where the children's under 5 vaccine is, and she's going to update us on that. And then our Elena and team will have an update at that point, and a lot more detail to follow. So today Elena is actually not available, but she is so amazing. She created some slides with the audio embedded. Hopefully it will work. I tested it this morning and it worked, so hopefully it still will. And we'll have our partner update as always. And the Health ECE COVID email has not gone away, so please continue to use that. So I believe, Melissa, you're on board. I created this space folder slide for you. Thank you, Melissa. Just wanted to say again that I appreciate the work you're doing and that you'll come back on Wednesday at noon. So I'll turn it over to you.
Sounds good. Did you not get my slides?
I did. So there.
Okay. Oh, there we go. Perfect.
That is a placeholder to remind people for the June 15th. So I'll send this out with that link as well.
Oh, perfect.
Sounds there you good. Go. There you go, Melissa.
Well, thanks for having me today. My name is Melissa Payan. I am EPA Region 8's Pollution Prevention, Water Sense and Safer Choice Coordinator. Region 8 serves 6 states, which includes Colorado, Wyoming, Utah, North Dakota, South Dakota, and Montana, as well as 28 tribal governments within those boundaries. I've been with the EPA for about 22 years. Prior to these programs, I worked in our prevention and oil spill response coordinator. I did that work for about 18 years. Both of these programs are very, very different. I mean, that program, I was an inspector. I worked with the regulated community. And the programs I'm in now, they're all voluntary programs. And usually when people think of the EPA, they always think of a regulatory agency that enforces laws and regulations and rules, which we are. We do have a ton of rules and regulations, but we also have a ton of voluntary programs, such as EPA Safer Choice Program. And that's what I'm here to talk to you guys about today. I like to compare Safer Choice to Energy Star because a lot of people are familiar with Energy Star, right? They know if they're going to buy an appliance such as a dishwasher or a microwave or a washer and dryer, they know if it's stamped with the Energy Star label that it's going to save energy as well as money. Safer Choice is very, very similar. We label cleaning products that are safer for human health and the environment. Next slide, please. Okay, so I don't know if you guys have experienced this, just as, you know, homeowners or even as business owners, but I am or can be overwhelmed when I am looking for cleaning products and trying to find ones that are not only going to do the job, but are safer for myself and my family and my pets, and then the broader community, right, when those products are being washed down the drain. So that's what the Safer Choice label is. It's basically, the goal of it is to help consumers see a label and just know that this product is going to be safer for my customers. Behind this hopefully very simple label that facilitates that very fast decision making is a very rigorous standard, which is verified by the EPA. So before products can carry this label, scientists have to review every single ingredient that goes in, regardless of the quantity or the amount that is in the product. The label also needs to meet performance standards as well as packaging requirements. If a product does qualify and has the Safer Choice label, it's entered into an agreement with the EPA for 3 years, and then we do annual audits just to make sure that if formulas are changed for whatever reason, that they're still meeting our standard. There is a very long standard behind this label, and we do have it available on our website if you guys want to look at it. We have about 1,900 different products that are available both in the retail and industrial space. The majority of our products are basic general cleaning products that you would use on a regular basis, such as all-purpose cleaners, dish soaps, hand soaps, laundry soaps, toilet bowl cleaners, bathroom cleaners, floor cleaners, carpet cleaners. And then we have some industrial products as well. And these types of products would be, you know, paint that is sprayed on athletic fields, say at children's schools. Next slide, please. Oh, so as Jane had mentioned, I'm going to be available at your office hours from, I think, noon to 1. If you guys have questions about Safer Choice, feel free, and hopefully you'll join me and you can ask specific questions. My goal is to try and encourage child care centers to invest in Safer Choice products. Again, this is a voluntary program. This is not, you know, something that we are enforcing or regulating, but just again, the overall goal is to make sure that you guys are familiar with the Safer Choice label, and then to maybe invest in some of those safer cleaning products. We do have a Safer Choice product tool. I can help you guys try and find these products online. I don't know how you guys shop, if you guys go to the store and physically buy them, or if you guys do a lot of your purchasing online, but we do have a product search tool that I can kind of help you maneuver. And then in addition to our Safer Choice label, we also offer the design for the environment label, or the DFE label. There's a label here in the corner. It's very hard to see. It looks very similar to Safer Choice, but that helps consumers identify products that have been reviewed by EPA to meet both pesticide registration requirements and there are certified disinfectants. So I'll be able to answer questions if you guys have questions about certified disinfectants as well. I think that's all I have.
And on Wednesday, would the other person, Claude, would he be able to attend as well to talk about disinfectants?
I will touch base and see if he is available during that time. Yes, and okay. We do have, so I specifically focus on Safer Choice, but we do have a pesticide outreach coordinator who can probably answer questions better about certified disinfectants and the use of pesticides. So I will see if he could come and answer any questions related to that as well.
Awesome. And I can't see the chat. I don't know if there's anything coming up specifically right now that you might be able to answer, or we can copy all of those and bring them with us on Wednesday as well.
I don't see anything in the chat right now, Jane.
Okay. Thank you. Thank you, Melissa. I know you're on a tight schedule today, so I appreciate you popping in.
Thank you guys for having me. Hopefully I'll see you on Wednesday.
Thank you.
Mm-hmm.
So I'll turn it over to Penny, who's going to update us on vaccines for adults and young children.
Hi, everyone. I wanted to start out with boosters for adults, as there is some confusion around those. So a second booster or 4 shot has been approved for adults over 50 years old and for people who are moderately to severely immunocompromised over 12 years old. Your occupation isn't any consideration in that. Sorry, I'm having a hard time finding the right term. And it doesn't matter that you live with somebody that is immunocompromised. It actually has to be you that's immunocompromised to be able to get the vaccine. When you are considering getting your second booster, if you qualify for that, you just need to really figure out your own risk factors and the timing. There hasn't been any concrete recommendations around this, which I think is why it's so confusing. Some people have run out and got it right away, but others might choose to wait until the fall when we expect to have a bigger surge, or wait until just a couple of weeks before they're going on a trip and have to fly. We do have a risk assessment that I linked here at the bottom of the slide on our webpage to help you navigate that. Next slide, please. Boosters, third shots have been approved for everyone in the 5 to 11-year-old age group as well. There's a link to a pretty easy to read COVID-19 vaccine schedule there. Next slide. Next slide, please. All right, so small fry vaccines, or little kid vaccines. We've been affectionately calling them small fries. The meetings were actually moved up a little bit, so they are going to start taking place on June 14th and will end on June 18th. We could have vaccine as early as June 20th, which is pretty exciting. For Moderna, it's still 2 doses, 28 days apart. Efficacy is a little different. It's for children under 2, it's 51% effective. For children 2 to 5 years old, 37% effective. Pfizer is 3 doses, 21 days. So between dose 1 and dose 2 is 21 days, and then between dose 2 and dose 3 is 8 weeks. For children 6 months through 5 years, it's 80.3% effective. And I know that's a pretty large difference. So we're kind of waiting to see what kind of impact that's going to have on a parent's choice. Some may still choose Moderna because it's only 2 doses versus 3, and some may go with Pfizer because it's more effective. Both vaccines are still doing a good job of keeping kids out of the hospital and from dying from COVID, which is really what they're meant to do. Next slide. And just some talking points for your parents, for your clients, parents of the children you're taking care of. The vaccine is really the safest way to protect children from severe illness and long-term effects. Children are less likely to die from COVID, but they can still get very sick. And really, we never know what the next variant of the virus is going to bring. That variant could be the one that affects children more than adults. They can still spread COVID, and they can still suffer from long-term effects from COVID. We're still learning about long-haul COVID, but we don't know that much information about it yet. There have been some research that it changes your brain, that the effect on your lungs can last a really long time. It's kind of silly, but I had COVID back in January. I did all the right things. It was just bad luck. But my hair has been falling out since then. And whether it's related or not, I don't know for sure. My stylist says it is. So just things to think about. Next slide. There's still a concern for myocarditis in a lot of parents. It's only been a small number. It's impacted males from 16 to 29 years old for the most part. And the risk is substantially lower for the younger age groups. Myocarditis is actually a risk of viral infections in general, including COVID. So the risk from getting vaccinated is actually less than getting COVID. And so far, no cases of multi-system inflammatory syndrome have been reported in the trials for the vaccines. Next slide. The side effects are the same as any other side effect: redness, swelling, tenderness at the injection site, some fatigue and irritability. Some kiddos do run a low-grade fever. They go away within a couple of days usually. Some children have no side effects at all. That was the case with the 5 to 11-year-olds. For a lot of those kids, they didn't have any side effects. They handled it really well. Any non-aspirin, so Tylenol or ibuprofen pain reliever, may be used to ease their discomfort. And we do have reporting systems in place for side effects and adverse events. Those are the VSafe. That's one of the ways that CDC is tracking side effects. And then also VAERS, that's the Vaccine Adverse Events Reporting System. Next slide. We get this a lot. If you've had COVID, how soon can you get vaccinated, or should you still get vaccinated? We don't really know how long anyone is protected after having COVID. So vaccination is still the safest strategy to prevent it. The vaccination should be referred until the person is fully recovered from their illness and outside of their isolation period. Individuals that have had COVID and are vaccinated actually have even better protection from future infections. And that's it for me. If you have any questions, I'll stick around for a few minutes. You can put them in the chat. As always, I'll put my email in there if anything comes up regarding vaccinations. And that's including routine vaccines as well.
Thank you, Penny. I have a few minutes if there's any questions you see at the moment that you could answer. I'm not looking at chat, but Dan or kind of, I'm not sure.
I don't see anything in the chat either.
Okay.
Thanks, Jane.
Thank you, Penny, for that information. I know it's been on our minds.
There is a hand up.
Okay.
Go ahead. Is it Dee Dee? Go ahead.
Dee Dee, are you trying to unmute?
There we go. Yes, I was. Hi, Jane. Hi, Penny. Thanks. Hey, I had a question about the myocarditis. When you mentioned that people are getting that infrequently, but from the vaccine, and also you get it from COVID, why would we get it from the vaccine if the vaccine is not a live virus?
That is an excellent question, and I don't actually know the mechanism behind that, but I can certainly look it up here in the next couple of minutes and post an answer in the chat.
Okay, thank you.
Of course.
Any other comments or questions? Thanks, Dee Dee. You always come up with the best questions.
Thanks, Jane.
All right, then we'll hopefully Penny will stick around for a little while as you consider new questions, but I will move us into Elena's recorded message. So it is supposed to, as I start it, advance itself and you'll hear Elena's voice. But if that doesn't happen, then I can manually activate her embedded message. So as you know, here's the team, and there is some work being done that she's going to talk a little bit about as we transition. I know these slides do not have any embedded messages, just the title slide.
Hi, Jane. This is Latoya. I'm not hearing anything on my end.
Okay, thanks for that message. It might be, it might be that I did not set the sound. Let me try to do. Then I can back up too. Try again. Thanks for the note.
First, we're going to look at our CDC community levels. So currently, as of this past Thursday, June 9th, we have remained in high community levels according to the CDC. So we'll break this down by metric. So the first metric we're looking at is the new COVID-19 cases per 100,000 population in the 7 days preceding when these were calculated. And at that time, we were at 379 cases per 100,000 population. So that automatically puts us in the bottom half of this table, which is dependent on whether you have greater than or less than 200 cases per 100,000 population. So the actual transmission levels in the county are high according to that metric. Now, while our percent of staffed inpatient beds occupied by COVID-19 patients is relatively low at 2.8%, the new COVID-19 hospital admissions per 100,000 population are higher than the threshold for high community levels. So at 16.4 new hospital admissions per 100,000 population, this is higher than the threshold of 10 or greater. So all of these metrics, or the 2 out of 3 metrics together, have put us in high community levels, and we have remained in high community levels for a couple of weeks now. The kind of the takeaway from this, the key messages to take home about our community level metrics are that case numbers, hospital admissions, and positivity, which we'll look at a little later, do remain high. And case numbers and hospital admissions continue to place stress on our healthcare systems in Boulder County.
Just double checking that you all heard that, right?
Yes, we can hear it.
Okay, thanks.
Okay, this slide is contains kind of a cool table that our surveillance team put together. And what this does is show our community levels over time. So as we just discussed on the previous slide, we've been in high community levels, and this table shows where we were at for each week from the week of April 14th to the most recent data week. So you can see we were in the green, which is low community levels for April and the first week in May. For the kind of middle of the May, we were in medium community levels, and we ended up transitioning to high, and we have remained in high since the week of May 26th. Looking at our the second column, which is the indicator for new cases per 100,000 population, it did seem like there was a little bit of a dip, and that things were maybe going to turn around and trend in a more positive direction the week of May 26th. But since then, we have seen the trend reverse and cases continue to rise. Okay, so I always like to wrap up these metrics with kind of the takeaways of what we can do to protect ourselves, protect our families, our coworkers. And again, these are always recommendations for community levels for the general population. And we've tended to recommend more protective precautions in childcare communities. But for the general population, we have now recommended additional precautions for individuals. So in addition to remaining or getting vaccinated, remaining up to date with your boosters, the general population, is recommended to wear medical grade masks indoors when out in public now. And as always, we're still strongly recommending anyone with symptoms to get tested, follow isolation and quarantine guidance if you're positive or if you've been exposed and are not up to date on vaccinations. And so really with high community levels, I just say just kind of the urgency around these precautions is increased. And we strongly recommend that, again, individuals really do what they can to make sure that they're staying home when sick, and when they are feeling healthy and around others, you're making sure that you're washing your hands, prioritizing events and activities that are outdoors or indoors with proper ventilation, and of course, masking in indoors when around folks outside of your household. Okay, now we'll take a minute to transition away from our CDC community levels and take a look at our own local data that our surveillance team has analyzed and prepared these slides for us for. So our 7-day rate of new cases of COVID-19 per 100,000 population, like you said, is on the rise again. So if you look all the way to the right-hand side of this table, you'll see kind of this visual of what the previous slides depicted. You know, we saw this continual rise through May. We thought that there was, you know, it was looking promising at the end of May. We thought we had a little bit of a plateau. But unfortunately, cases have continued to rise. Of course, everything is relative, and certainly we are nowhere near the levels that we were observing back in January with the initial Omicron surge. But as always, it's really important to keep in mind that this data does not capture those that are testing positive on at-home tests, but are not getting tested at a community site. So this is, as always, an underestimation of the true volume of cases in the community, and it's really important to keep that context in mind. Okay, in the slide here, we're looking at our 7-day positivity. Again, kind of a visual depiction of what we've already been describing in the previous slides. So again, percent positivity, along with cases, along with hospital admissions, is on the rise. As of June 7th, our 7-day PCR percent positivity, again, for PCR tests, testing that are done in the community, not including at-home tests. As of June 7th, this was at 13.3%. So again, for context, for percent positivity, you know, I think the meaning of this metric has certainly changed over time with the abundance of at-home tests, which again are not reflected in these data. But I'd say really the takeaway still is that, you know, we would love to see percent positivity, you know, not above 5%. And so seeing it above 10% right now, you know, certainly tracks with what we would expect with the rising case volume. Of course, everything's relative. Back in January, we were looking at, you know, around 25% positivity at some time points. So while 13.3% is lower than we were seeing in January, it's still higher, certainly higher than we would like to see at this point in the response. And before we transition away from looking at data for the week, we wanted to leave you with this slide, which has links to, you know, some of the key COVID data resources at the local level that we use to communicate, you know, local trends, you know, what folks in the community should do to protect themselves. So I think many of you are familiar with this CDC community levels and where to find those. But these links are links to many different local data sources, including, you know, the case rates and percent positivity and hospital capacity that we present here, but also a couple links to CDPHE's outbreak page, as well as a link to the State Health Department's wastewater surveillance tracking program, which is an interesting additional perspective. So instead of looking just at clinically detected cases, the wastewater looks at how much COVID-19 is detected in wastewater, which does tend to track pretty well with clinical cases. So yeah, these are really interesting local data sources, and I hope that some of you find this useful to help do a dive on your own. Okay, so earlier we mentioned that in the next few weeks, we're going to be working with you all to find a more sustainable approach to case tracking moving forward. You all have just been absolutely phenomenal with your case reporting. I know that is no small undertaking to be reporting all cases of COVID among staff and childcare attendees to us, and we are incredibly grateful for your cooperation over the last couple of years. Moving forward, we are going to be reducing our ECE EPI team staff as we discussed before. And, while this is, it's really sad to be scaling back our teams, but, this is the reality that local public health agencies are facing right now as our COVID funding is waning and we have to scale back the temporary workforce that was hired to work exclusively on the COVID response. So we've mentioned this before, but again, just really important context to be aware of that in the coming months, probably through, I would say, the end of August, our team in particular is going to be scaling back our staff, and we are going to be working towards really returning to routine communicable disease support for childcare providers. So what that means is that, this dedicated ECE EPI team after the summer will not continue to exist. Of course, we are still going to have communicable disease epidemiologists working with our division in BCPH to respond to clusters and outbreaks. And of course, there is still going to be epidemiology staff to help support you with your questions about best practices, infection prevention. So, that resource and support isn't going anywhere, but just the volume, the timeliness of our responses will be scaled back because there's going to be fewer staff working on this response. Of course, we do not plan on leaving you empty-handed. And so there have been a couple things that we've been doing recently to make sure that we are preparing you all for this transition. So one of the things that we did was send out a link to a survey last week, and we're incredibly grateful to folks that completed the survey and provided feedback. It really helped us understand your perceptions of where you are with your ability to determine when folks need to be excluded from care, your confidence in your ability to determine when they're allowed to return. All of those things really helped us kind of shape what resources and tools we are developing for you to kind of make this a smooth transition away from the levels of support we've been providing for individual cases so far. So what does that mean? So I think really important, let's just be very clear here. We're asking you to not make any changes at this time. So please continue to report individual cases to us, and we will be in communication with you all in the coming weeks. So next Wednesday, June 22nd, we have a scheduled office hours. We strongly encourage anyone who's able to attend to please attend for that hour. We're going to be going over really what the future expectations of case reporting, what those are, and we're going to be doing a walkthrough of some tools and resources that we've developed in response to your survey feedback to help you all track cases, calculate return timelines, and other aspects without so much direct support from our staff. We will record the office hours if you cannot make it, and we will also continue to communicate updates, expectations, tools, and resources over email. So if you're not able to make it to office hours, don't worry, we will still be in communication with you in the coming weeks. So with that said, at a really high level, what we are moving toward is we want to be in a place where we no longer have to ask you to report every single individual case of COVID-19 to us. While COVID-19 is technically still a reportable condition, the reality is that there just won't be enough LPH, our public health agency staff, to respond to individual cases. and we really need to dedicate our time to where we're seeing clusters or early signs of an outbreak. Also, you have all you've developed so much, your skills that you have all developed over the last 2 years to figure out exclusion and return timelines. I think you're all in a really good place to be able to determine that without having to report each case to us. Again, here's where the resources and tools come in. We're going to provide you with those, so individuals that don't have as much confidence in their ability to respond to individual cases without BCPH support will have tools and resources for you, completely optional, of course. But yeah, I think it's kind of a bittersweet transition, but because we've really enjoyed working with you all over the years. But I think this is going to be a good way to reduce the amount of documentation and workload you all are sending to us for individual cases, and really help the communicable disease epidemiologists that are staying on, again, focus our time and resources where it's really needed, where we're seeing early signs of spread in facilities. Now, again, I know this is kind of vague, very high level, and this is why I've said, please don't change anything, keep doing what you're doing, and we'll communicate with you over the next week or two as changes are ready to be rolled out. But really, again, at the high level, it's going to be, you won't need to report individual cases to us. You will absolutely still be required by statute to report clusters and outbreaks, and we will provide some really clear guidance on kind of what those thresholds are. But really, at the end of the day, what we're looking for is reach out to us if you have questions. Reach out to us if you have concerns, as always. But definitely reach out to us if you're seeing an increase in COVID-19 that is more than you would be expecting. So again, don't worry, we're not leaving you high and dry, but we will absolutely be in touch over the next week or two with more concrete information as we're ready to roll out some of these steps.
So before I move into the partner update, I know there might be some questions, and we'll have some time after the partners. I know some of Elena's team are here, and among and between us, we can probably answer some of your questions. So go ahead and put any questions you have in chat, and we will have some time for that. So with that, I'll turn it into the partner update. Jody should be on the line, I think, for child care assistance program.
Thanks so much, Jane, and thanks all public health staff for all this great information. I do have some things to share with you about changes to state CCAP beginning July 1st, and I'm sure you've heard some rumblings about this. And maybe you'll have some questions, and hopefully I can help answer them. So this is in relation to the stimulus money strategies that are being implemented. There is a slight increase to the income eligibility limits for families who are applying for CCAP. So for Boulder County, we were at 265% of the federal poverty guidelines, and we're going to move to 270%. So the new threshold for a family of 4 will be almost $6,000 per month. So that's we'll be able to include quite a few more families. In terms of helping increase access for CCAP families, the Department of Early Childhood is implementing a grant program for providers with Colorado Shines ratings 3 through 5 who accept CCAP. So that's a little caveat there, and that will increase compensation for your educators, for your early childhood educators. I think the most exciting change, and I'm going to put in a little request to realize that this doesn't mean that ATS is going away. ATS use is still going to be required, but payment is going to be made based on authorized enrollment for children ages 0 to 3, so all your infants and toddlers. Again, ATS use is still required, even though payment will not be based on attendance. This is scheduled to sunset in 2024, but there is a lot of analysis and conversation happening to see what's possible beyond that, because in my humble opinion, you should all be paid that way for all children. One more thing to mention is a rule change coming, which reduces the paid absences. So a decrease for to 3 paid absences for levels 1 and 2 and 4 for levels 3 through 5. We at Boulder County are in the process of analyzing our allocation. We'd love to sustain where we are at the levels paid absences at 6 for levels 1 and 2 and 7 for levels 3 through 5. So more information to come on that. I think, did I paste my information in the chat already? I think I did. Great. Any questions about all that? Have a great afternoon, everyone. Thank you.
Thank you, Jody. A lot of changes on the horizon. Thank you. Amy, I'm not sure if it's Amy, is updating today for the Early Childhood Council Boulder County. But Amy Carlo. Or maybe Mary Lynn. I'm not sure if anyone is here from. I'm not hearing anyone, so I'll leave the floor open for the Office of Early Childhood. I know they're extremely busy right now, but if anyone is here from our licensing department and would like to have a few minutes, please go ahead. I'm not getting any takers there either. So I'll just move to our questions and remind you that we will be taking July off and no meeting. A lot of people are on vacation and in and out. So we'll continue with our office hours. I'll update on email, as Elena mentioned, as we get new information, but we won't hold this particular meeting in July. We will come back in August. August 8th would be our next scheduled meeting. And again, it will be noon, and I'll send out reminders with a link for that one. We'll have our Healthy CE COVID email for probably another year, probably next year. We'll get rid of that, but for now, we'll still have that as long as it's useful. And I'm going to drop this screen, and if there's other questions in chat. Okay, it looks like
New things in chat, Jane.
there is. Okay, go ahead.
Did look up the situation with the heart condition. I'm blanking on the name, but the body's immune system creates an inflammatory response to an infection or other trigger, which in this case would be the vaccine. So the immune system goes into overdrive, so to speak. So that's why the heart condition comes up both with the vaccine and with the disease.
Thank you for that.
And then the office hours are June 22nd from noon to 1. Are we having office hours this week too, Jane, on the 15th?
Yes, we are with the EPA doing their presentation. And the office hours link on Wednesdays is the same link every week. So it's, and I attached it to the reminder for this meeting. But if you need it, you can let me know. I'll send it out again.
And does anyone have any leads on where we can acquire tests for the school community? So running low on COVID tests. Do we have any information on that?
Tests for the school community. I know that they have the state order is still available. I don't know if there's anyone from the EPI team, Latoya, Krista, that has any other response to that.
Yes, Kaylin just put a response in the chat.
Kaylin did. Thank you, Kaylin.
You're welcome.
Yeah, Jane, I just dropped it in there. It has the email address, Andrea, for the school, the CDPHE school team.
Thank
And they're
you.
really the best point of contact for trying to get those test kits ordered.
Thank you. You guys are amazingly helpful. I see Dee Dee has her hand up. Dee Dee, was it related to something we're in discussion right now?
No, I have a question in the chat. I don't know why my hand was up.
Okay.
But you're going through the questions, so you'll come upon
Yes.
it.
Okay. Thank you. I'll let
Okay.
Kyla keep going then.
Sure. So I believe this is what Dee Dee's question was. Could you talk about community levels versus transmission levels, which is what we used to use? Where can we still find transmission levels, and are they a better reflection of what's going on? I'm hoping one of our EPIs can explain that.
Yeah, I'm hoping Kaylin, Latoya, anyone.
So I'll take an attempt at it. So community levels, like Elena explained, they take into consideration a couple different things. So the hospital admissions, the 7-day average, and also, hold on, let me pull it up. And also new COVID-19 cases per 100,000. And so they take into consideration all those different factors versus the old metric of transmission levels, which took into consideration the actual case rate for the county or the state. And so with this change, it's not giving you, it's taking into consideration a couple of different things, but not solely just the case rate. And so now where we are, when we think about case rate and the number that's being reported, it's basically giving you a number of people who are actually being tested, and those cases are being reported to the state. And it's not taking into consideration home tests that are not being reported. So it can actually, at this point, when we see so much home testing, it can give you, I guess, for lack of a better word, a false number, because it's not taking into consideration those home tests. So I guess right now we think it's best to consider all factors, thinking about your community levels and whether you're in high, medium, or low, and consider all the things that the recommendations based on the community level. Anything else you would add, Krista or Kaylin?
Kaylin put a nice link into.
Yeah, the CDC kind of changed their metrics and, local health departments followed. So there's really not much we can do about how it's reported now. I believe there were the case rates if I'm not mistaken, in the slides from today's meeting. So if you go back, you can see those listed there. And then it puts them into the categories of low, medium, and high transmission.
And I'll send out the PowerPoint so you can link those directly.
And for that old level, just the old way that CDC calculated it, I believe it's still on their site. I can try to find that really quickly for you, Dee Dee.
Thank you. Kyla?
The next one is fun. EPIs, do we have any experience with monkeypox?
Oh. Penny was talking a little bit about that too.
Yeah, our team only deals with COVID, so I'm afraid I'm not going to be of much help.
And last I heard from our immunization team, Penny did not have any information as far as vaccines, but you could email her directly. I don't know if she's still on. Oh, you are, Penny, go ahead.
Yeah, if there comes a time that we need vaccines, it is not that time. The state or the CDC will provide those to local public health agencies, so don't panic yet. The last I heard, there were only 2 cases in the entire state. I'm not sure what that number is now. I haven't checked in a couple of days.
Great. I'm not gonna worry about monkeypox. So one less thing to worry about. We have some more information on where to get COVID tests. That was through CDC, I think. And then Jody, are these changes available in written format somewhere? I'm not sure what Amy was referring to there.
CCAP is what they're referring to. And Jody, are you still on? Not sure. And I didn't hear for sure if Jody, she typically always does have updates in written format. So if you, I think she left her email in the chat. So if you'd like to contact her directly, you could probably get it in written format.
Great. Then we have, okay, I think we caught up with the where to get tests. And links, contact info is all in here. Information for the office hours. Definitely look at the chat because there's lots of links and emails. So
The chat, the link, I did put the office hours link in chat. It's the same every Wednesday. So you can use it for this Wednesday and next Wednesday and every one thereafter.
And so I think that we've either addressed the correct questions either verbally and or in the chat. So if there's anything else, I see a hand. Who that is? Dee, do you still have a question?
No, I don't know how to erase that hand, but yeah, I'll put it in the chat if I do. Thank you.
I can lower it for you, Dee Dee. There you go.
Okay. Okay, thanks.
Uh-huh. Any other, it looks like Penny put her email in there if you have questions regarding immunizations. I see Andrea's asking a question about, the chat. Okay, I guess you got that figured out now, right, Andrea? Okay. And Latoya put a little more information in around the community transmissions. Thanks, Andrea. How CDC has defined and advised around those. So I think we answered them all. If there is any others you'd like to put in the chat or unmute and ask directly, we've got a couple minutes.
Hey, Jane, it's Dee Dee.
Yeah.
Andrea's question about, did you just answer that? I was fiddling with trying to get my hand down.
She was asking about chat, I believe.
She was asking about the household versus the
She asked
COVID test for the school.
Oh, she asked that one too. Okay.
Yeah, I mean, if you go to their website, it says get free at home tests where you can get free at home tests, but I think that's like maybe 4 or 8 of them. But if you needed, say, 50 for your school, is that on that same website?
Yeah, that's a different question. I don't know, Kaylin or someone in that group has some information because that for the school to get that quantity is a different process. Kaylin, can you speak to that?
Yeah, hi Dee Dee. I shared those links, but just send an email to Health ECE if you still have questions about it because it's really confusing. But the first link shared is for ordering tests from the I think from the government, and they do just send out, I think it's 4 to 8 for families. But for ordering bulk testing, that would be going through CDPHE, and they have a special process for that. You have to get a CLIA waiver, which basically allows you to authorize the testing, and then they would send out the bulk testing. And I shared a link in there for summer programming, but we haven't really heard anything about the upcoming school year and if they're going to have ECEs be eligible for that or not. But there's a link in the chat to the contact at CDPHE, and they're really the best resource for trying to get some of that state bulk testing. But if you have questions, just email us and I can resend all of that.
Okay, thanks, because I'm not seeing it in the chat. Andrea's comment about where to get tests for the school is the last thing I can see, so I'm not sure where it went.
Okay, I'll send that to you.
I appreciate it. Thanks so much.
Of course.
Thank you. Is there any other questions that we've missed or have come to mind as we discuss these things? I know there's probably some questions regarding those next steps, which we're actually in development of right now. So we'll stay tuned on that, and we'll get to you as soon as we know a little more about those tools and the processes that we'll put in place as we recover from COVID. Or change, I should say, that the process is changing. All right, then, if there is no other questions, thank you for the 55 minutes that we had for you. And we will hopefully see some of you on the next few Wednesdays. And then reminder, no July meeting. We'll be back on this August 8th, Monday partner meeting. And we'll have some updated information at that time on our next steps as well. So thanks, everyone. Have a great afternoon.